Cures across the centuries, a journey through 2,000 years of medicine. Let me take you on a journey not just through history, but through healing. Over the last 2,000 years, humans have battled pain, disease, injury, and death with creativity, courage, and care. From clay tablets and sacred herbs to surgeries and synthetic drugs, we've sought to understand what ails the body and how to mend it. But before scalpels gleamed in operating rooms and pills lined pharmacy shelves, medicine was a deeply spiritual, sensory, and symbolic craft. So let us begin where healing began, not in laboratories, but in temples, huts, deserts, and forests. Part 1. Ancient Medicine. Healing with Nature and Spirit 1. Mesopotamia. In the land between the rivers, the Tigris and the Euphrates, illness was more than a biological inconvenience, it was a cosmic disruption. If a man had seizures, it wasn't epilepsy, it was possession by a demon. The healer's toolkit: cantations, amulets, and herbal mixtures. He might mash mustard seeds, figs, and beer, apply it to the head, and chant to Ea, God of Wisdom. Remedies were recorded on clay tablets using cuneiform, precise and methodical. There were two kinds of healers: the Asu, a practical physician using herbs, bandages, and oils; the Ashapu, a spiritual practitioner who diagnosed the anger of gods. Techniques: herbalism, ritual purification, ointments, bleeding via cuts or leeches. To ancient Egypt. Egyptian medicine married science and religion. Illness was either a blockage in bodily channels or the wrath of gods. Imagine a woman with a swollen abdomen, perhaps a uterine tumor or cyst. A healer consults the Ebers Papyrus, a scroll nearly 20 meters long. He applies honey and myrrh, known for antimicrobial properties. He might also insert pessaries of herbs to draw out impurities. Mummification gave them detailed anatomical knowledge. Surgeons knew how to set bones and treat wounds. But all was done under the eye of gods like Thoth and Sekhmet. Techniques: surgeries with bronze tools, topical antiseptics, enemas, prayers, amulets. 3. Ancient India. Ayurveda. India's medical system, Ayurveda, is as much a philosophy as a practice. Health is harmony between body, mind, spirit, and the cosmos. A man suffering from high blood pressure would be diagnosed with a pitta dosha imbalance, too much heat, anger, and acidity. He'd be prescribed cooling herbs like Brahmi or ashwagandha, oil massages, and meditation. For surgery, texts like the Sushruta Samhita described over 300 procedures. Cataract surgery was done using a needle to displace the lens. Rudimentary yet bold techniques: herbal therapy, massage, dietary regulation, surgery, cauterization, detox. 4. Traditional Chinese medicine. Harmony of energies in ancient China. The body was a garden of flowing energy, or qi traveling through meridians. Sickness was a blockage in this flow. If someone had asthma, the physician might diagnose a lung qi deficiency. Treatment included acupuncture, cupping, and moxibustion, burning dried mugwort near the skin. The Huangdi Neijin, a foundational text, emphasized preventive care and balance over crisis intervention. Techniques: acupuncture, pulse diagnosis, herbal formulas, Tai Chi energy balancing, cupping. From gods to logic. Hippocrates, the father of medicine, rejected divine causes of illness, proposed the four humors: blood, phlegm, black bile, yellow bile. Health was their balance. A man with a fever was thought to have excess yellow bile, might be bled with leeches or given a barley water purge. Galen, in Rome, expanded this into a complex system. He performed animal dissections to map anatomy. Surgery evolved. Romans treated soldiers with wine-soaked dressings, amputated limbs, and drained abscesses. Techniques: humoral therapy, bloodletting, surgery, purging, hot-cold baths, dietary control. Part 2. Medieval and Islamic medicine, preservation and integration 1. Medieval Europe. With the fall of Rome came the decline of rational medicine. Monasteries became the guardians of ancient texts, but superstition returned. Illnesses like epilepsy or plague were attributed to sins or divine punishment. Yet not all was darkness. Midwives and folk healers used centuries-old herbal lore to treat fevers, infections, and childbirth complications. A patient with pneumonia might be given a broth of thyme, sage, and garlic, and told to pray to a saint. Techniques: bloodletting, charms, pilgrimages, herbal decoctions, bone setting. 2. Islamic Golden Age, while Europe stalled. The Islamic world surged ahead. Scholars like Avicenna and Al-Razi translated and expanded Greek texts. They emphasized clinical observation, quarantine, and hospitals with wards and pharmacies. Avicenna's canon of medicine systematized diagnosis and treatment. For depression, he suggested talk therapy, music, and rest centuries before Freud. Cataract surgeries were refined. Compound drugs were developed: syrups, ointments, and pills for pain, fever, and infections. Techniques: hospital-based care, distillation of drugs, surgical innovations, psychological therapy. Part 3. Renaissance to early modern medicine, dissection and discovery. The Renaissance brought curiosity back to the body. Vesalius, in the 16th century, dissected cadavers and corrected centuries of Galenic errors. Physicians now began learning from the dead to treat the living. Paracelsus introduced chemical medicine, claiming disease was caused by external agents, not just humoral imbalances. Syphilis, a terrifying new disease, was treated with mercury rubs, dangerous, but occasionally effective. Surgery advanced, but still without anesthesia. A leg amputation relied on speed, a saw, and the patient's courage. Techniques: anatomical dissection, iatrochemistry, mercury treatments, battlefield surgery, blood transfusion attempts. Part 4. Enlightenment to the modern revolution. The microscope changed everything. In 1676, Leeuwenhoek saw bacteria. In the 19th century, Pasteur and Koch proved the germ theory. Antisepsis, pioneered by Joseph Lister, introduced sterilization in surgery. Chloroform and ether began to relieve pain in operations. Jenner's smallpox vaccine laid the foundation for immunization. A child who once risked death from smallpox could now live with a single injection. Mental illness began to be treated with compassion in places like Le Bicêtre Hospital, under Philippe Pinel, who unchained the insane. Techniques: vaccination, anesthesia, antiseptics, microscopes, compassionate psychiatry. Part 5. Echoes and advances. Ancient wisdom, modern science, even in today's high-tech world, ancient medicine lives on. Acupuncture is used in pain clinics. Ayurvedic herbs like turmeric and ashwagandha are in capsules worldwide. Yoga and Tai Chi are recognized for stress, arthritis, and balance. Leeches return in microsurgery. Maggots clean wounds. Honey dressings help heal diabetic ulcers. Ancient practices now backed by science. Modern medicine brings MRI machines, organ transplants, gene therapy, and AI diagnostics at the holistic ideals of the past return through integrative medicine. Techniques today combine digital diagnostics plus ancient wellness, synthetic drugs plus herbal adjuncts, surgery plus mind-body support. Conclusion: 3 minutes. From temple chants to robotic arms, medicine has evolved, but never abandoned its core purpose: to ease suffering and prolong life. Our ancestors treated the ill with plants, prayers, and intuition. Today we do so with precision tools and vast knowledge. Yet the wisdom of the ancients whispers, still urging balance, humility, and compassion. So, as we marvel at what we can now achieve in medicine, let us remember those who first dared to care with hands full of herbs, hearts full of hope, and eyes turned toward the stars.